Welcome, everyone. I'm going to go ahead and start just to keep us on time. I know a few more people may join us, but thank you all for attending our February Tobacco-Free Tuesdays webinar. We're so thankful that you're here. This is the day after Valentine's Day, and I think we have a very appropriate message for today with really how to focus on your heart health this month and tobacco prevention as well. So we have an exciting webinar. Thank you again for joining. I do want to take this time to introduce all of our regional coordinators. We finally, for the first time in a long time, have our entire team with us. I am Gina Roberts. I am the lead regional coordinator, and I focus on the southwest part of Virginia. We have Sarah Burkhead. She focuses on the central region in Virginia and is at the Richmond Health District. We have Carrie Cannon, and she's with our North region and is at the Fairfax Health District. And we have Nicole Mann from the Eastern region at the Portsmouth Health District. And our newest member, Tiffany Eustace, yay, Tiffany. And we're so thankful you're here with us and joining our team. And she is at the Blue Ridge Health District in the Northwest region. So this is your group. I know we have a lot of partners out there, a lot of coalition workers, a lot of just champions and advocates for tobacco control. And if you have something in your community to work on, whether it's getting a provider site to go as a referral site or a business or organization to go tobacco free, we're the people that we hope you contact to get that started and to get us working with you. So we're here for you. So thank you for joining today with us. So I did want to introduce our team since we're all together. Nicole will be monitoring the chat box and the Q&A. So after the speakers complete their presentation, you can please put as many questions you want in the Q&A, and we will open that up and get started with that. If you have been with us for a while, and we've been doing our Tobacco-Free Tuesdays webinar since, I believe it was last May or June, and we've really enjoyed kind of having this time to be with all of our contacts and partners in the communities. We do a what's the tea with tobacco? What's the latest? What do you know about tobacco? What do you want to know about tobacco? And here's our question for today. So which of the following organs or systems in the body have not been shown to negatively be impacted by tobacco or smoking? You can choose more than one. So you have your eyes, your immune system, your skin, your reproductive organs, your heart, your liver, bladder, kidney, joints, teeth, and gums. And I'm scrolling down a little. So choose one, choose more than one. Which do you think are not negatively impacted by tobacco? Choose as many as you like. We will see the answers. Take a couple more seconds and choose as many, and then Sarah will pop up what you chose and see what y'all are thinking on this day after Valentine's Day. Okay, so wow, okay, all over the board. So eyes, everybody chose a little bit of everything. The joints, 50%, I guess, got the most. Reproductive organs, 39. Eyes, 33, that were not impacted by tobacco use. Okay, let me close this out. Or maybe you have to do that, Sarah. Okay. That was a trick question, okay? Because, sorry about that, but that was a trick question. All of them are negatively impacted by smoking. All of them. According to the Surgeon General, smoking impacts nearly every organ of the body. And even beyond the risk to the tobacco user, there's also no risk-free level for secondhand smoke either. And that's why I think, you know, Robin Gahan is here and Dr. Phillip, Duncan is here. And we're really going to focus on heart health and how it's really impacted by tobacco use. Because still, after all these years, tobacco use is the most preventable form of death. So we really need to not forget that as we kind of go through the work that we're doing. So I want to kind of introduce our speakers today. Thank them very much for joining us. We're excited to have one of our tobacco control partners, Robin Gahan, who's the Vice President of Health for the American Heart Association in Richmond. And as part of American Heart Month, we've asked her if she knew of any wonderful speakers to join us, and she connected us with Dr. Phillip Duncan. Dr. Duncan is the current board chair for the American Heart Association in Richmond. So again, we're thrilled to have you, and I'd like to share just a little bit more about Dr. Duncan, and I know Robin may as well, but Dr. Duncan is a native of New York, now lives in Chester, Virginia, and has 2 daughters and 3 grandchildren. He founded the Heart Care for You, the Cardiac Health Management Network, in 2014. Dr. Duncan has practiced patient-centered cardiology in Richmond and the Tri-County areas for over 30 years. And currently, Dr. Duncan is the medical director of the Cardiac Health Management Network. And he also serves as the operations medical director for Honeywell, Chesterfield, and Hopewell campuses. And, you know, in talking with Sarah and just knowing more about the work that you do, Dr. Duncan, I've learned that you are truly the advocate for a healthy lifestyle. And you're an expert, you're a leader in the communities. I've heard that you really go out and you speak at all organizations, churches, businesses, and really try to promote this healthy lifestyle. And so you really walk the walk, and you really make it easy for people in our communities to relate and to really to make our lives and our health better. So thank you so much for joining us. Robin, thank you for being here. I'm going to turn it over to both of you and stop talking so you can really give us your expertise in this field. And thank you again so much.
Thank you so much, Gina. And special shout out to Sarah, who's my partner in crime here in the Greater Richmond area. We're so excited to have her support and expertise as a volunteer of the American Heart Association. And of course, Dr. Duncan has been such a champion, as Gina shared, and we're really fortunate to have you, Dr. Duncan, with us today, and your continued leadership. So I'm going to share my screen. Give me 1 second here. Let's see. All right, can you all see the PowerPoint okay and not my notes? Wonderful. Okay, it's great when you get that right. So good morning, everyone. It is American Heart Month, and this is a month where we work to raise awareness of the impacts of heart disease and stroke. And so for the American Heart Month for 2022, we've launched a campaign called Reclaim Your Rhythm. And so it's a really fun concept, and you know, some folks might be thinking, why reclaim your rhythm? So we're helping people create healthy habits that work best for their life and to give them a best chance at life. As you can imagine, people are tired, and with the impact of the COVID-19 pandemic and everything that's happened over the last 2 years, even people who normally focus on their health have lost that rhythm. And so CVD, cardiovascular disease, is still the greatest health threat, but COVID and all the complexity that has occurred because of COVID remains top of mind for us. So people are experiencing lower physical and emotional wellness, and heart disease deaths rose significantly last year. Dr. Duncan?
So yeah, looks like I'm on. So you know, with COVID, since the onset of COVID, what we've seen is that we know that cardiovascular death and stroke have risen significantly since COVID began, and you know, we know that beyond just death, the disability and effect on our overall health has been pretty significant. You know, for example, you know, 1 in 5 people have reported feeling less well since this COVID pandemic has begun. We know that even people with mild to moderate COVID have had continued symptoms and suffer symptoms of fatigue, brain fog, and there may be long-term effects on heart health that we're yet to see. We're not going to know for at least another several years, really. And most of all, I think all of us, and actually I think that this might even be understating it, it's suggested that 1 in 3 people have reported a decrease in emotional wellness as a result of COVID. And I think that's an underestimate. I think we've all been affected on some level by COVID because of its effect on our communities, on our families, and of course on many of us as individuals. Robin, let's see. We do know that the AHA is hoping to create healthy habits and help us to work for the best life that we can have. We want to give people a chance for the best life, and now's the time that we want to continue this program of reclaiming your rhythm and take back control of our physical health and our mental well-being. And I would say we shouldn't even separate the two, because our mental well-being is truly a part of our physical health. So as a part of today's program, we want to share a conversation that discusses the impact of smoking on our physical health and in that way also our mental well-being.
Thank you, Dr. Duncan. Yeah, I couldn't agree with you more. You know, we tend to break things out into silos of physical health and emotional health, but really they're also interconnected, and it's really about whole body wellness. So, you know, focusing on the topic today around tobacco use and the impact of tobacco on heart health, just want to highlight for you all that one of the top priorities for the American Heart Association continues to be preventing and controlling tobacco and e-cigarette use. This is something that is nationally across our 5 different regions, as well as in our local community impact markets. So like the Greater Richmond market, tobacco is one of those top 3 priorities, along with blood pressure control and increasing nutrition security. So, you know, the great news is we know that smoking rates are down overall, but there are still too many adults who smoke, who vape, or use other forms of tobacco. And we see this especially between the ages of 21 and 34. And also, while not surprising to probably most of today's audience, that dramatic rise we've been continuing to see in youth vaping is very much cause for alarm. So fewer teens are smoking cigarettes, right? So we look kind of chronologically, you know, 1997, 1 in 4 teens were smoking tobacco and cigarettes. In 2018, that decreased quite significantly to 1 in 20. And, you know, there's a lot of achievement that was made by the public health and tobacco control community to achieve that level. But tragically, we are seeing a new youth epidemic, and that's vaping. And in 2020, 1 in 5 teens are vaping. Dr. Duncan, back to you.
Okay. So I'm going to go over this slide in a little bit more detail in a minute, but start out by saying that we have to understand that in smoking, patients taking nicotine, which is a poison, and understand that that's a poison. 50 to 60 milligrams of nicotine, that's about the amount of nicotine in 5 cigarettes, is fatal. So that is what people take in on a daily basis, and you figure there's enough nicotine in a pack of cigarettes to kill 4 to 5 people. So we need to recognize that. You know, this slide I sort of want to go through because it speaks so much to us of the benefit of discontinuation of the use of tobacco products. So we know that smoking harms every tissue of the body. We know that from our initial question. We know that smoking increases the risk of heart disease and stroke by 2 to 4-fold, and that nicotine within just a few minutes, you know, in less than 30 minutes of taking a nicotine, it increases heart rate, makes blood pressure go up. And about 1/3 of all deaths from heart disease are due to smoking. And we're talking about smoking. We're not going into the cancer risks. But the positive side of that is that there's such a tremendous benefit of discontinuation. So again, within the first hour of stopping the use of nicotine products, the heart rate and blood pressure come down. Within the first 8 hours, sorry, I need to make sure I pull up my slide and get. So within the first 8 hours, we reduce our carbon monoxide levels. So, one of the things that I often will say to patients is that, the equivalent of smoking a pack of cigarettes a day is like going in your yard or your garage, turning on your car, putting your mouth around the exhaust, taking a big whiff. And that's about the carbon monoxide that you take in with a pack of cigarettes a day. But within 8 hours, that begins to clear. Within 48 hours, we start to improve our taste and smell, which have been dulled by the chronic use of nicotine. And within 3 days, we know that our lungs start to respond. Our lungs that have been attacked by these nicotine products start to relax and improve. Within a few months, circulation to the lungs and lung function improves. Again, one of the things I like to share with patients is that in many of these nicotine products, so in cigarettes, there are tars also, in addition to the nicotine. And our lungs are equipped with little hairs called cilia that sort of push out debris. Well, you think about just laying tar over those. That's what happens when we smoke cigarettes. Vaping, we're just learning because now we have a much more efficient delivery system that delivers that nicotine product with water vapor. So that can get to the farthest reaches of our lung tissue. And so it'll be years before we understand the negative effects of vaping. Within 1 to 9 months, we find that our lungs and our sinuses start to recover. We start to clear mucus, and some patients will actually get a worse, smoker's cough after they quit, because now things start to work and start to remove some of that debris. But within the first year, the risk of heart disease drops to half of what it was as a smoker. Within 5 years, the risk of stroke drops to that of a non-smoker, and the risk of cancer of the mouth, esophagus, bladder are cut in half, as well as the risk of cervical cancer falls to that of a smoker, because all those risks were increased by smoking. It takes 10 years for the risk of lung cancer to decrease. And one of the interesting things, and Robin knows I'm good for going off script, so I apologize. But one of the things that was interesting is that one of the downsides of women smoking at the levels that men did was that what we saw when we looked at lung cancer rates, the rates of increases in numbers of lung cancer cases in women lagged men by about 20 years. And when you look at the time that women started to smoke at similar levels to men, it took about 20 years for us to start to see the increase in lung cancer. So this is one of the areas where, between cardiovascular disease and cancer, we would prefer that the gender equality goes in the other way, that women and men decrease to the same low levels by avoiding the use of these substances. It takes about 15 years to approach the low risk or lower risk of a non-smoker. And that's what folks need to understand, that the effects of smoking last far beyond cessation, but the benefits begin almost immediately within the first hour. I don't know. I'm looking at my own slides, Robin, so.
I think, and you covered a lot of this
Yeah.
about, carbon monoxide, but just, I think the connection with cholesterol was something, even for me working at the Heart Association, was really like a thing that I hadn't connected, right? When we think about all of the impact of tobacco use.
So one of the things that that nicotine also does is it activates your bad cholesterol and increases plaque production, but also nicotine in cigarette smoke. I give it I try and describe it to folks who are familiar with these things as a Brillo pad on the vessels, where it roughens up the vessels and makes them more susceptible to developing plaque, and also makes that plaque a lot more susceptible to rupture and the rapid development of vascular disease, both in the heart as well as in the legs, as well as the vessels going up to the brain. So that leads to the increased risk of heart attack, but also stroke and significant peripheral vascular disease. The important thing, as I said, is that women who smoke have a 25% higher risk of heart disease as compared to men who smoke. So the risk for women is actually higher, and there are lots of reasons why that may occur, but some of it may have to do with the size of the vessels. We know that with certain types of heart disease, women are at greater risk, or even after things like surgery and our interventions like angioplasty, we know women are at our higher risk, and it may be because of difference in anatomy. So actually, women who smoke are at higher risk of these adverse events than men who smoke. We know that smoking leads to heart disease, and that's the #1 killer of women. And we know that it is one of the significant drivers for heart attack.
Thank you so much, Dr. Duncan. And we're going to pop this link in the chat. But, you know, for all the times that these questions might linger with you, and if Dr. Duncan isn't your personal cardiologist, we'll just, you know, we've got more resources than one could even desire located on our website, heart.org. But I just want to thank you so much, Dr. Duncan, for your insights and your knowledge on the impact of tobacco use and heart health, and especially knowing that, you know, you've worked with patients for many years who've, you know, gone through the journey of quitting and seeing those impacts and improvements in their overall health, so that we can all live those longer, healthier lives. It's the mission of the American Heart Association. So just on the screen here for you are just a couple samples of resources on our website, really tailored to all of the different types of consumer audiences, including folks who are interested in quitting, to parents and educators who are working with youth and understanding the impact of vaping, and how you know, youth are being impacted and targeted for vaping use by the tobacco industry. And of course, as well, for our healthcare professionals, public health advocates, really all of the resources at your fingertips. So please be sure to check that out for all the information you could ever desire. So with that said, I think we're gonna turn it over to some question and answers.
Hi, this is Nicole Mahan. So again, the regional coordinator from the Eastern region. Yes, we do have some questions that came in during registration period, but today it seems like people are a little quiet this morning, so none in the Q&A. So I'll start from some questions. Dr. Duncan, you kind of covered overall nicotine and tobacco use, but someone asked specifically, what are the health risks for hookah and vaping? And I know you touched on vaping just a little bit, that it's, you know, very new. We're still learning everything. And I remember a researcher pulled up a picture of someone's airway of like a non-vapor, a smoker, and someone who vapes. And I remember that the person who was vaping, their throat looked kind of like sunburned, not sunburned, but like it looked burnt. And people were talking about how, you know, with vaping, the temperature is so much higher and they're inhaling it, which is different from, you know, smoking a combustible cigarette. So I know that's very interesting, you know, when everyone was seeing that. So I don't know if you have anything else specific for health risks specific to hookah and vaping if you want to add on to what you said about nicotine and vaping already.
Yeah, well, again, for so many things, it takes a while for us to truly understand the risk. And I think vaping has nefariously really targeted the youth, which is the biggest concern that I have. The lungs are a tremendous drug delivery system just because of their size. And when you think of adding high temperature and fine water droplets, you can get to the deepest recesses of the lungs, as I said. And so I'm quite concerned that not only are you delivering these poisons, in the farthest regions of the lungs so they can get to the body, far more efficiently, but you're doing it with this addition of water vapor, which may, we understand that water is not supposed to be in our lungs. so even that can be harmful. So I think, like so many other things about smoking and the use of nicotine products, it's going to take another 10, 15, 20 years before we begin to see the effects of what's going on now. Scariest thing to me is, here in town, sometimes I'll drive up our main street, Broad Street, and it is actually frightening to see the number of tobacco and vaping shops that are growing up all over, targeting our younger demographic. So yeah, it's scary.
Nicole, can I jump in here 1 second? Because there was a Pam Ray from the Blacksburg area put something in the chat just on this topic of vaping. And she said she's just doing, which she does, tremendous education in that area at high schools and middle schools. And she said there were 30 to 40% vaping rates in the high schools and 25% in the middle schools. And then there was some chat about, but they don't even think about the health impact right now. They're young, they're doing what their peers are doing. How do you think we can get them to realize the health impact at that age with vaping or with smoking, even though the smoking rates are really down? I know I'm just throwing that out to you if you have any thoughts to that, because that's just such a concern for us.
I mean, the unfortunate part of this, and I've got 3 teenage grandkids and one who's 3, so that I'm actually up to 4 now. But as I've told my daughters who went through their teenage period, that there's a period of life in which we're all brain damaged, and that's our teenage and young adult years. Our prefrontal cortexes aren't developed well enough, and so we have poor impulse control, and so it's very difficult to come up with strategies to alter the behavior of those of us going through our teenage and young adult years, because that's when we're learning to become independent from our parents. So at the end of the day, while it's helpful to let people know, share the knowledge that we have, we actually have to start to look at what we do on other levels. What kind of guide rails can we help create around this to sort of help us through those years so that we survive our brain damage years and make it to adulthood where the brain starts to function a bit more normally. It's a challenge to change the behavior of teenagers and young adults. And there are good aspects to that, but clearly with respect to vaping, it's a challenge.
Yeah, I would just add to that I think, like Dr. Duncan mentioned, those guardrails. So the American Heart Association, works very hard to advance public policy at both state, local, and federal level, supporting, efforts for the FDA to have, much stricter guidance and rulings around tobacco, particularly vaping and menthol and flavored products. But more at that micro level, thinking about, the work that Pam raised, while I certainly am not, in that type of role, I'm sure she's seen that youth listen to other youth, right? We know that they're feeling invincible, they're feeling independent, they don't want an adult to tell them another thing. And so, I'm seeing a lot of really tremendous examples, even here in the greater Richmond area with the Henrico Too Smart to Start Coalition that Sarah and I are members of, working with their youth ambassadors, seeing nationally, the American Heart Association has our Tobacco Endgame campaign, which is really focused on youth voices. So as much as possible, building up that, student leadership, those who are really, they're those leaders are there, and some of them are willing to really take a stand against something and against peer pressure, and really have that positive peer pressure for their peers, as well as, what are the messages that can be shared within schools that students can really discuss and share on social media. So I'll be sure to drop the link for the Tobacco Endgame for folks like Pam who are working with youth to share that resource with them.
I also wanted to add, just back on vaping, is that there are lots of flavors. As we know, we've kind of been fighting that fight. A lot of flavors have been approved by the FDA, to eat, but it hasn't been approved to, heat up and inhale. So just keep that in mind as well. I think, cinnamon, popcorn flavoring are the two that come to mind that has been really popular that causes, other lung injuries. And I wanted to also promote our program called Live Vape Free. It's pretty new, as vaping and EVALI has come up, we as well are trying to improve our services and, what we can provide. So we've actually, with Optum, created Live Vape Free. LiveVapeFreeVA.org is the website, and I linked it in the chat as well. And just so you guys know, it is targeted to youth, so it's an educational program, and it's text-based as well. So if youth, want information or they want support and helping to quit, they can use that as well. And then in addition, there's a parent aspect to that too. So parents can kind of learn more about vaping, how they can speak to their teen. So it works both ways. So I'm sure Pam, I know Sarah has shared that with Pam, or Gina, I forget what region you're in, but anyone can use that as well, and it's free. So again, that's livevapefreeva.org, and that's linked in the chat box as well. I think that is a great resource, and we're doing a media campaign with it too. So hopefully, more and more people are able to see that and use that program as well. And then
Nicole, I'm sorry, I realized I forgot to address when you mentioned the hookah, excuse me.
Mm-hmm.
So, one of the things we're starting to see in the research that, when folks vape, it's the aerosol, we think of it, right, like Dr. Duncan said, it's like a water vapor, but that almost sounds so innocent, right? It's just a water vapor. Obviously, we don't want water in our lungs, but we're really seeing that it's more like an aerosol, like hairspray. When you think about when you spray hairspray on your hair versus water on your hair, what's going to happen, So I think you having that visual context, like Dr. Duncan talked about, the tar sticking on the cilia in your lungs. We are concerned about the way that the vaping aerosols are impacting heart and lung health, as well as with hookah. Users consume the equivalent amount of nicotine as up to 100 cigarettes. So we're thinking about what Dr. Duncan said about the amount of nicotine in a pack of cigarettes and how poisonous that is and how that can be fatal. That's absolutely a concern as well.
Thank you for clarifying that, Robin, because you're right. When you think of vapor, you think of water vapor. And, I think, words do have meanings and the connotation. And so if you think, oh, it's just water, or tells their parents and the parents don't know, they're going to think, it's fine. So, I think resources that really educate parents as well to what really, they may be innocently buying their children, that's important as well. So thank you for clarifying that. The next question is, this person just completed a tobacco treatment program, and they're interested in some of your motivational techniques.
So I realize that people need carrots, not just sticks. And that's why I think often sharing with people the benefits of quitting over, the risks and associated with smoking is often takes people a lot further and is a lot more helpful. One of the other things that I found, especially with some younger folks, is diversionary activities. So one of the things I know I did with my grandsons is there are some stairs at a park here, a place called Libby Park here in Richmond. It's I think 157 stairs. So I started doing some walks up and down the stairs with the two of them when they were both playing around with vaping. And it's sort of embarrassing for a youngster who plays basketball to find that their grandfather can outwalk them up and down a set of stairs. So that actually helped. And then we sort of associated that with what some of the habits might be. And that's, again, activities using carrots, not, as much as we use sticks. I think those are some of the things that we can do to help.
I love that. Can I add one thing? I heard a tobacco treatment specialist once say that they asked their, they worked with adults, but asked adults who use tobacco, why don't you use more? And they were kind of taken aback, like, why would you be asking me that? You're talking to me about quitting. But their first reaction was like, I can't afford that. Who can afford to smoke more? Or, oh my gosh, that would kill me, that my health is already on the edge. Or I would never see my kids because I'd be out on the street, use smoking more. And so whatever their reaction was, tapped into something that they then turned and used as the motivation. And I thought that was really interesting and not something I would have thought of on my own.
I like that one. Yeah.
I think that's great, Sarah. That kind of leads into a question someone else asked. Well, Dr. Duncan, you were saying, that your grandsons who they were embarrassed that you could walk up the stairs better than them, it kind of helps them see the effects of tobacco and nicotine, in themselves, kind of before it's too late, I guess. And someone mentioned how other people sharing, how tobacco nicotine has affected them can really be a great source to educate others. And I wanted to kind of point out that the CDC has, the Former Tips campaign, and that is tips from former smokers. People have probably seen it on, TV commercials or radios or whatnot. And I can link that in the chat too. And I think Pam Ray talked about, or I think it was Tiffany who mentioned that, youth listen to youth. And so having youth talking to each other, and, there was, I forgot the young man's name, but there's a young man who spoke at the last, tobacco or health conference, I forget. And he was a great speaker and talked about how, he was vaping and his friends, and he really saw, that addiction. And he went around and kind of inspirational talks just to say, this has happened to me. I didn't think, I thought I was invincible. I didn't think it would happen to me, but it did. So I think that's, a really great way to really educate someone and help them understand, especially youth, how this can harm them, especially when you talked about vaping, and we don't really know the long-term effects of that yet, just how we didn't know the long-term effects about cigarettes, until years and years down the line as well. What else do we have?
I just added to the chat another thing, thinking about, the connection with youth as well, and, youth being targeted with vaping. We also know historically and currently African American and Black communities have been very disproportionately targeted by the tobacco industry. So when we think about the health equity around that, we look at higher rates of hypertension, and we look at higher rates of or lack of access to affordable food, but ease in getting tobacco products at a convenience store. We think we really have to look at those environmental factors as well. But the link I just put in the chat is a very, very powerful, kind of like a spoken word video about how long will you target me? And that's something that I think youth can really engage with as well. As a great resource.
Thank you for sharing that. Yeah, I think that's really powerful. With like social media and YouTube, I think, there are various ways that we can, spread this awareness and educate people. So I'm happy to see, people using in different organizations using different avenues and being creative. And we have, I think, one more question, and this is to Dr. Duncan, I believe. Excuse me. We know tobacco use affects every organ, including your heart. Of your peer cardiologists, how many do you think actively refer their patients, excuse me, to a tobacco cessation program? We are curious when they may be most likely to address it, typically as prevention, after heart attacks, before surgery, and for those who don't, why, and how can we get them on board?
Well, that's a great question, and it does sort of shine a light and cause us as providers to look in the mirror. Unfortunately, I think it is smoking is always mentioned, and usually as a negative effect. Usually the opportunity, when people do it is when something's going on, when people are being affected by the smoking as opposed to in routine visits. So I think sadly, sending people to smoking cessation is done far too infrequently. And the other piece too is we need more programs. We need to have more programs funded to look at ways to actually get people to discontinue their tobacco and nicotine use. I would say that, again, when we look at tobacco use, we have to sort of look at it in bundles. So we have an older population that grew up with cigarettes. I know there was a comment about, having ads talking about what's the preferred cigarettes for doctors back a long time ago. So this was a cultural icon. If you look at old movies, I like to watch old clips of Columbo, and I noticed he always had a cigarette or a cigar. So, you've got that age group, usually who are dealing with the ravages of nicotine or smoking related diseases, whether it's heart disease, also cancers, issues, head and neck cancers, lung cancer, emphysema. But this younger group, it is, I think, truly in the realm of other professionals, because often, if it's mentioned in their, let's say their pediatrician's office or family practitioner's office, I don't think much time is spent on it. But also we need to start to look at again, the kind of infrastructure we have for these young folks, as well as for their behavioral health, because that is, I think, what it's related to. And the reality is, if we want to change the outcome from this, the new wave of vaping and the use of hookahs, we need to hit it at the roots, and that's really at the level of school counseling, behavioral health specialists and primary care specialists. We need to raise our concern now, because we're not going to deal with the results of this until decades down the line.
Dr. Duncan, I will have to continue that conversation with you offline too, just to find ways that we as, VDH's tobacco control program team can make sure that providers have the cessation resources that we know of, and that we can give them, any other resources that they need. And for all of you on the call, I just want to challenge you too, to brainstorm with us, to help us spread the word to schools, behavioral health organizations, to providers. We'd love to hear what you think would really help to reignite. I think that word was used at the beginning of this call, to reignite that passion around cessation. And cessation in and of itself is a prevention initiative. As we see rates go down for adults and youth, we'll see rates continue to go down. So please help us out. If it's not in the chat, reach out to us after the webinar. We'd love to hear from everyone.
And thank you for sharing that. Yeah, we are trying to work more with behavioral health and trying to spread the word in physician's office and working with schools as well. And I wanted to point out a great local resource for my area called Rethink Vape, rethinkvape.org. That's linked in the chat. And they started off interviewing youth and adults about vaping, and they actually have worked with pediatricians locally at CHKD in Norfolk to try to actually implement it into their EHR and trying to implement, asking, that prevention. And they also have great one-pagers for parents, teachers, did I say parents? But it's on their resources page. And they also have printouts too. So doctors' offices can have those, on the back of the doors, wherever. And they also have pocket cards for physicians to kind of keep it on their mind too. So I'm kind of missing all the details, but if you look on rethinkfaith.org, it's a great resource, great researchers in Norfolk that'll gladly, want to work with you. And get that information out there. It's great to partner and learn more resources, because I think, like we've said, it's hard working on tobacco control and prevention cessation, but it's great to know everyone who's kind of working on it, and we're all working towards the same end goal and the same solution as well. So that was the major summary of what we have for questions. And I think Gina has some more to kind of talk about. So I think I'll lead it to her to go on to our next return the tea question, kind of sum up everything.
Great. Thank you, Nicole. And thank you, Dr. Duncan and Robin, for joining us today. I think we have lots to still do in this state and our communities. And I think your presentations have really motivated us, inspired us, and challenged us, as Sarah was mentioning, to really come together to make sure we have the resources, the tools in place to help people who want to quit smoking to quit, and also the policies in place to make it the norm not to smoke, right? To where you're not seeing it in the schools, you're not seeing it when you're driving down the street, you're not seeing it when you walk out of your workplace. And I think those policy changes will make a big impact. So again, we have a lot of work to do, and I think that we have the people to do it. I'm very inspired by the conversation that we've had today and the partners that we have in our communities to do this. So thank you so much for joining us, and we really appreciate your expertise and your knowledge on this. And now we're going to switch to the last what's the tea question, and we're doing a fun question a little bit around Valentine's Day, the day of love, the day of your heart. So Sarah's going to put up this question, and I'm going to read it because I want you to read each question just to see this. Which of these are not true according to the National Retail Federation on American spending on 2022's Valentine's Day? Pick only one. 47, I find these very interesting. 47% of adults were not planning on celebrating Valentine's Day, yet 70% of Americans say that receiving a gift for Valentine's Day is very important to them. So I think a lot of people were very disappointed maybe yesterday, but I don't know. The second question, their second choice is Americans will spend a total of $23.9 billion on Valentine's. 23.9 billion. Okay. Americans will spend $2 billion on candy alone. That one's probably true, but I'm just, okay. The next one, 50% of annual flower sales happen around Valentine's Day. The next one, Americans will spend $12 billion on their pets for Valentine's Day. Another true one. An estimated $9.5 billion will be spent on unwanted gifts. Okay. So this is one, choose the one, and this is only single choice, choose the one that is not true, that you think is not true.
I like that Gina was giving her opinions there.
No, I know most of those are true. The candy, the pets, the unwanted gifts, I know. But anyway, I'll stop talking and choose another second of your choice. And Sarah does so well. She has to like write out the answer for me. So I know these and I'm able to speak to these afterwards. So, I love Zoom. Love Zoom. Okay, so Sarah, show us the answer. Okay, now this is what's not true. And the leading one is 50% of annual flower sales happen around, the leading one they said was an estimated 9.5 billion will be spent on unwanted gifts. That is actually true. we have so many unwanted things in our houses right now, right? The one that was true is 50% of annual flower sales happen around Valentine's Day. That is not true. 30% of annual flower sales are spent around Valentine's Day. So all of that other stuff that we're seeing there, 23.9 billion on Valentine's were actually spent. And I will tell you a kind of a secret. I don't know if I was supposed to share this, but we were going to do the poll because we wanted to compare it to the number of dollars that the tobacco industry spends each year. And we found out, because we thought the number of the dollars that tobacco industry spends would be more than the Valentine's that we spend, but we found out that was not true. So tobacco companies spend 22 million per day, or about 240, no, to an astounding $8.2 billion a year, which is less than all that we spent on Valentine's Day overall. So we couldn't actually present that question the way we wanted to, but still an amazing amount that the tobacco industry does spend each year, $8.2 billion, to really market their products to certain populations, to everyone, to use, to African Americans, to really get them to use the products. And that's the challenge that we every day are faced with. So again, we just kind of presented that in a fun way to really focus on Valentine's Day too, but it shows the challenge that we have out there. So I hope you enjoyed that. And I hope you enjoyed the webinar today. Really lots of great information. Please put next month's webinar on your calendar, March 15th from 10 until 11. We're going to have the filmmaker Lincoln Mundy come, and he's going to discuss his upcoming documentary revealing targeting marketing tactics of the e-cigarette companies, something we've just been talking about. If you've seen Lincoln Mundy's Black Lives, Black Lungs documentary, it's very fascinating. And this documentary, the new documentary that he's going to be promoting, will even go into more detail, and I think will be very interesting for all of us to see and promote in our local communities out there, because this is what we want to use and really get this information to our young people, to our partners, to the leaders in the community also. And we know the leaders are the ones that really make that impact with the policy change. So please come out next month and join us, March the 15th. And we had probably about 45 people on the call today. Please, each of you, invite others in your community to join. We would love to have more and more joining us each month. So share your registration information, share the invite to others and have them join. So again, I'm going to wrap it up. We'll have about 5 minutes left to our day. Again, have a wonderful February, a wonderful day after Valentine's Day. Enjoy, and we will hope to see you back on March the 15th. Talk to you later. Bye.